I'm Dr. Danish. Welcome to the 50 Shades of Pain show. For many patients, healthcare often feels like a factory that whitewashes problems with pills or churns out one-size-fits-all solutions with surgery. I'm not sure if we had an interruption there or not. Anyways, I'm Dr. Danish. I'm a native Kentuckian and the medical director of Wellward Regenerative Medicine. As a Johns Hopkins trained double board certified anesthesiologist and regenerative pain specialist, I believe it's time to revive the caring spirit of healthcare and offer you, the patient, the healing that you deserve. This 50 Shades of Pain show is one way we empower you to receive sustainable treatment for injuries and pain without surgery, addictive medications, or becoming a victim to the system that's designed to work against your healing. I encourage you to start your healing journey at wellwardmed.com. Today I'm with my co-host, Dr. James Escalini. He serves as the physical therapist and physician extender of our practice, and like me, he's seen firsthand countless patients who have, not because of lack of qualified or caring doctors, but from a broken healthcare system, seen a lot of suffering unnecessarily. So James, what are we talking about today?
You guys at home are in for a treat. Today we are going to be talking about stem cells. So, when you say stem cells, that's that big controversial thing, but at the same time, this stuff is everywhere for all sorts of different reasons. If you go to see a cancer doctor, they're doing some miraculous things with stem cells. You go to see around the corner here, I can have stem cells shot into my knee and I can sprint like I was 10 years old again. You even have veterinarians working this on the equine area, getting to those amazing Kentucky Derby horses. So there's all this hype around it, but I think we need a little bit of truth for this matter. And you know what? You guys at home, you're in for a treat because we got this guy right here. All right? He's Johns Hopkins trained. He's super smart and just an all-around good guy. All right? Let's bring him over here. Danish Maslamdus. Yes. All right. So, Dr. Danish, I need some help to understand this a little bit more. Stem cells. What exactly are these things?
So, James, I know you struggle with this, but for the rest of us that have a little bit of hair left, we're on a constant state of growth in our bodies. Like if we have skin breakdown, if we have nails that we clip, if we get our hair cut, it's constantly growing. And some of that is because just normal cells are replicating and that's what they're supposed to do. But oftentimes when there's an injury or a scrape or a cut or some damage that occurs in the body, you have cells that are distributed throughout the body whose only role is to hold on to the blueprint that is your body. And when there's any kind of injury in the body, those cells react to that injury and they send blueprint messages to all the other cells in the area telling them how they're supposed to put themselves back together to reform into new healthy tissue. So the stem cells in the body are located literally everywhere, but they're in highest concentration in areas where you have fat, around your blood vessels, and in greatest concentrations in your bone marrow, because that's where you're producing red blood cells on a regular basis. Without those stem cells, you wouldn't have a blueprint of how to put yourself back together. And so oftentimes what happens is that injury or that damage either gets put back together with scar tissue, which isn't going to be as healthy and resilient as normal tissue is, or it just fails to reform. And in the body, there's always this constant balance between breaking down and damage versus rebuilding up with the help of these cells. That's their role in the body. Now, how we use them in the context of pain and injury is a different conversation. So I guess that's my segue to the different conversation. So what we do in regenerative medicine is, first and foremost, we want to understand why the body hurts. Using pain as the compass to understand what are the mechanical damages in the body that are either unable to repair or that they have formed some scar tissue or some damaged tissue in there that's not acting the way it should be, and thereby causing pain. So I'll give you an example. Like, let's take a patellar tendon injury or some kind of a tendon issue. Tendons have very linear fibers like this. And if a tendon is damaged but then repaired with scar tissue, that scar tissue doesn't necessarily form back into linear fibers like this. And you can imagine this has a lot of tensile strength, meaning if you pulled my left arm and somebody else pulled my right arm, because these fibers are in a linear pattern, they're not going to tear easily. But what do you think would happen if these fibers were turned like this? Like they're all kind of mashed up and mangled together. Now every time you pull on this, they're not working as a cohesive group of fibers. They're all working in different directions, so it's evident that these are not going to hold the same level of tension, and they're just going to break and open up and cause re-tears and injury and pain. So what we do with stem cells is we want to understand where these fibers are no longer in this linear pattern, because it's not always evident, it's not always obvious, and then disrupt them to give the body an incentive to repair. But if it's not able to, then put in some stem cells so they can provide the blueprint, the instructions on what the body needs to do and how to get it back into that fibrous linearity that's going to hold tension.
So it's kind of like starting from scratch again when you put a stem cell into an injured area.
Right. You're giving the body instruction on what should be there to begin with. And then if the resources are available and the rehabilitation that the body needs to recreate that structure, the stresses that we put on the body are what are also giving instruction to the body as to what to do. We're just adding another layer of much more robust, much more aggressive instruction for the body to set up its repair process again.
Okay, this makes sense why these Kentucky Derby horses would be getting stem cells put into them, and why all these veterinarians swear by them. But this is where I got to take a step back. Why is there such a controversy behind stem cells?
A number of reasons. One is it's misunderstood. Some people think that it's derived from embryos, and it's not. We're primarily using stem cells that your body produces. In some cases, there are people who are extracting it from the byproducts of birth, because there's a high concentration of stem cells there, and they label these as stem cells, but it's inaccurate. It's not really stem cells. It's just really potent growth factors, because when you process those cells, there's no way you can keep them alive. So they're not going to be viable cells that go back into your body. They're just simply amped up growth factors that we can use to amplify the effects of the same blueprint stem cells that your body has. That's where those are the two major areas of controversy. Is one is, are these embryonic? Are we causing harm to a potential life by using these? And we're not. The second is, what is an actual stem cell? Is it something that your body has and produces, or is it something that can be manufactured in a lab and given back to you? And at this point, we don't have that technology, regardless of what a lot of people label these as. They're not stem cells unless they're derived from your own body. We don't have the technology to actually put live cells back into you. We don't have the FDA clearance for that. These have to be products that are just essentially chemicals as opposed to live cells.
So for the stuff that we would want to be having put inside our own body, we would want to have not the embryonic stuff you're talking about, not the stuff that's created in a lab, but stuff like you were talking about from either our bone marrow or our fat.
Right, yes. So that's where we get the stem cells that we use in our office. We can supplement it with platelet-rich plasma to amp up the growth factors, or use embryonic-derived stuff, that post-birth products that you can get from a pharmaceutical manufacturer. Those can amplify the effects of the stem cells, but nothing is going to give your body the same kind of instruction that your own body's autologous stem cells can do. Autologous means derived from you.
Oh, okay. Well, it makes more sense. That's why you give blood to the surgeon before you're going to have surgery, so that you've got some of your own blood in case you need it afterwards, right?
Right. So blood's a good example. There is a cross-matching process where I can get other people. My blood type is, like my motto, be positive.
I love it. All right.
But I can get blood from other people who are B positive, but I can't get it from everybody. With stem cells, they are personalized to you. The growth factors that are labeled stem cells and are not, those are able to be put into anyone because they are essentially just the growth factors, not the cells that have all the antigens or parts of them that could potentially react to you or somebody else.
This sounds pretty complicated.
It isn't simple, but it's not uber complicated. I do caution people about just going to a clinic that advertises stem cell therapies, because a lot of those clinics they're just revenue streams for these places. It's not somewhere they've put in a great deal of thought. They've done a lot of research. It's a lot easier to put your money into marketing than it is into education and training. So if you're looking for some kind of a regenerative therapy, what I often see as a good barometer as to someone who's legitimately providing some solid thought process behind the treatments they're providing versus somebody who's just trying to profiteer is if they have studied prolotherapy techniques, if they have looked into the biomechanics of the body, if they can understand the neuroanatomic pathways of the body. These are things that I've spent years, literal years, and on top of the years of just basic education, additional years of training, tens of thousands, if not hundreds of thousands of dollars in just training to learn these techniques and be good at them. I wouldn't trust this approach to somebody who's just gone to a weekend course or a mid-level provider who connects with another doctor or chiropractor or someone who's able to do these in their office, but they haven't seen the same training. It's almost like who would you want to do brain surgery on you? A neurosurgeon who spent 15 years learning their craft, or somebody who went to a weekend course? This is not unlike that. I mean, what we're doing is, I call it surgery without surgery, because it is that rigorous and that complex. What we're just not doing is opening the body up to get to where we need to go. We're defining what tissues are damaged, what nuts and bolts of that area is not working together. We're understanding how we can get to those places in a way where we don't have to open everything up and be able to look inside. And then finally, we need to know what we need to put into those places, because not every orthobiologic or every stem cell injection has the same composition. They can have different cell types and different concentrations to get the best response out of different tissues. And that's an area that's just now starting to take off.
That's pretty interesting, because I think I've even read some stuff where people just say, oh, all we got to do is shoot it in there and you'll be fine, you'll be feeling just like new. Just pay 20 grand right up front, you'll be good.
And that stuff really, really bothers me, because you will get a response from the stem cell injection, but it's not going to be a radically different response than, say, the standard of care, which is just standard injections. And that's how a lot of these things are being used by untrained professionals, is they take steroids out of the equation and now introduce either stem cells or PRP and use them in the same way, which is a very basic single shot injection, say for instance into the knee. And that really doesn't provide longevity. It will, because those cells are going to have growth factors, blueprints, instructions, they're going to modulate the inflammation in that joint, and make it feel better for a while. What I'm after is a cure. I'm after getting you well enough to where you're not coming back on a regular basis to get treatment. And the only way we can do that is by taking a much more holistic perspective, looking at the joint in detail, understanding the biomechanics, developing the rehabilitation plan. All of that goes into understanding how to best use these very expensive, very difficult to access cells in your body, so you're not just wasting them by putting them in here. Frankly, nobody has looked at what is the longevity of accessing these stem cells. And while I don't want to raise alarms about that, I don't think it's something we should take lightly. You do have cells that will replicate and will produce new stem cells, but how many times can they do that? And so if we're going to be accessing stem cells, then we want to do so in a very mindful, deliberate way, as opposed to, here's $10,000 and you're gonna miraculously cure my aging needs. It doesn't work that way. There's a lot more deliberation and thought behind it, and I really encourage people to do their homework before they commit to something like that, because I hate for this burgeoning field of medicine to get a bad reputation because of people who are not doing their due diligence in offering these services to people.
Wow, that gave me a lot to think about right there. So now you got me thinking about something else. You said that you can get stem cells from fat tissue. So does that mean if I go eat a lot of donuts, then my joints will be feeling better?
So when you look at the composition of fat, there are fat cells that hold pockets of fat, and then there are tiny little dots of stem cells around those fat cells. When you gain weight, you're not adding more tissue. You're actually just adding more fat inside of those cells that hold those pockets of fat. So you're not getting more and more cells in that area. You're just getting bigger and fatter and chunkier cells. So no, it doesn't. You're not going to get more stem cells in your body by eating a hamburger 3 meals a day, 7 days a week.
That sounded fantastic.
Yeah, I know. We could try it out and we could see, but I guarantee you we're not going to get the results that we're hoping for.
I'm willing to make a sacrifice on that test. We'll see how it goes. So if you've got somebody who's got some sort of knee osteoarthritis, they're like a little bit younger, maybe 40s and 50s, and all they're getting offered is a knee replacement, what does that patient go through if they come to Wellworth? Well,
so anytime a surgery is being offered, I like to try to think creatively and see if there's a better alternative. Because I'll tell you the worst case scenario that we get to if we pursue a regenerative strategy. If you're going into surgery with tissue that is worn out, it's fibrous, it's kind of like thin silk that has a whole bunch of tears in it, and they're trying to recreate new strong bonds in that tissue. Every time they put a suture into that weak silk, it's just going to tear again. So they have to clump up a whole bunch of tissue in order to create one suture that's going to hold. If we do a regenerative therapy, even if it doesn't work, the worst case scenario is that we have just made that thin frayed silk into nice hardy denim. And now when the surgeon tries to put a suture into it, it's much, much more fortified and able to hold those tension lines. But that's the worst case scenario. Our ideal scenario is we're able to intervene at a stage of development of that degenerative joint where we can actually tilt the scale away from degradation outpacing repair and switch this so that our repair is now outpacing the degradation. And progressively over time, that joint becomes stronger and stronger and stronger as opposed to this constant decline towards an inevitable surgery. And that starts with understanding the biomechanics of a joint. So we've talked a lot about the way arthritis is formed. It's because of loss of integrity of that joint where it's slipping and sliding and causing both friction, erosion, but also every time it slides, it's pivoting on a much smaller surface area. And that's why you get the erosion that comes with arthritis.
See a previous episode.
Yeah, exactly. Yeah, I think it was 1 or 2 episodes ago.
Mm-hmm.
So when we're using stem cells, we're doing it for a couple of purposes. One is we want to first identify which of these ligaments have lost their integrity and become slipping, that aren't holding their load and allowing that joint to slip and slide. If it's something that has fibers within there and they're holding, but they're just weak, it might not need stem cell therapy. It might be fine with just like a prolotherapy or a PRP, some other kind of orthobiologic. But if it's tissue that has significantly lost its stability, its integrity, it's really not even holding much strength, or if it's a tissue that doesn't have a lot of circulation, like for instance the ACL, which is on the interior of the knee, those are situations in which I would be more prone to using stem cells, because that's a situation where I know the resources needed to get that tissue back up to health are just going to be a challenge to get there, and it needs a bigger oomph to it. The other scenario that's really, really helpful, and this has been some fantastic research done out of France, is when you're seeing later stage arthritis, like stage 3 or stage 4, what's often happening is that there's been so much shifting and moving in there that these two bones have been bouncing off of each other. And it's to the point where the bone marrow underneath the cartilage is now bruised, and almost like you've got tiny little fractures within that. Well, the cartilage is only fed through bone marrow. So if the bone marrow is struggling, it's not going to give enough resources to the cartilage, and that's where you see the bone erosion. So even if we were to stabilize the ligaments, if the bone marrow has been bruised, it's going to have a hard time feeding the cartilage and getting the cartilage to grow. In those situations, bone marrow stem cells are fantastic, because by repairing the bone marrow underneath the cartilage, we're able to provide resources to the sub-architecture of that cartilage and allow the cartilage to then grow and become healthy again.
Wow. I didn't even consider for especially those other scenarios you talked about with other practitioners when they're just shooting it in. Well, even if they did get that good stem cell composition onto the right area on an MRI, they're not taking into consideration, why did that happen in the first place?
Right.
Is this joint shaky, and that's why this spot keeps on getting worn down? Well, yeah, let's put some bolster this material right here, but let's keep it running back and forth over there anyway. And it's a great way to get repeat customers. Wow.
Yeah, we've done an episode on pain mapping before, and I can't stress how important that is. That's really a key feature to what we do as an institution. Is we want to understand the biomechanics, the cellular composition, the neural pathways, every aspect of that degenerative structure. We want to take apart and understand in detail, so that when we put things back together, it's going to be a lasting solution, not one that's just going to be a blip and then in a year or two it's gone. I remember I was working an event once, and somebody came up to me, and I introduced myself and told them what I do, and they said, "Oh yeah, I had some stem cells last year, and it's about time for me to go get them again." And I just cringed, because I knew he'd spent several $1,000s in getting this treatment done, and to think that it's only lasting him a year just made my heart ache, because that's the kind of outcome that I feel like gives this burgeoning field a bad reputation. We have to uphold the scientific backing of this approach. Otherwise, this just becomes something that is a fad and it goes away because people lose faith in its abilities.
Wow. Well, you also mentioned something about rehabilitation for this as a big part of that. Like, tell me more about what Wellware does differently with that.
Yeah, so let's say for instance, you've got the blueprints to build a house, but you don't have the awareness of the weather conditions in which this house has to be built. So instead of using like one nail against the post, you should be using 2 or 3 to fortify that. Well, the only way for the body to know how strong it needs to make a structure is by experiencing different stressors across that structure. So what we do is we collaborate with physical therapists out in the community, and educate them about the protocols that are the leading edge of science, things that have really made some big strides. And that's the stuff that I really rely on. Dr. Escaloni is being very humble in this situation and asking my opinion, but it's really a question that I need to mirror back to him, because he's the one that's helping design a lot of these treatment protocols and finding outcomes that finding rehab techniques that really amplify the outcomes. Without that, I think this can be just a very expensive blip on the radar. You really need the solid rehabilitation plan afterwards, and that's such a key part of who we are and what we do.
So it sounds like if somebody has some problems, they come into Wellward, they get some pain mapping to figure out where's the pain coming from and why it's there in the first place. Then after that's diagnosed and they choose some regenerative pathway like stem cells, then they get it, then they get some good care from a very smart dude, and then they get some fantastic rehabilitation that they're keeping on with it with the top rehabilitation they can possibly get. Okay, well, how do we know that it works even after all that? How do we know it's not just the rehabilitation?
So for a number of reasons. One, if it was just the rehabilitation, then it should have already worked, because I would anticipate that person has had some of that rehabilitation. And I mean, I don't want to expend a lot of people's money for something that just a regular physical therapy approach would be able to, or an advanced physical therapy approach would be able to resolve. To me, that's not a good utilization of resources. I want to think from as if I had a family member, or if I was in this position, what kind of advice would I want to hear? And it's not every single scenario needs a PRP or a stem cell or the most leading edge technology. Sometimes very basic things are all we need, like changing your diet, quitting smoking, doing certain types of exercises to get the structure back into better alignment with the rest of the load of the body. And I would want those things tried first before we explore some of the regenerative techniques, because why not? Even if, again, going back to those worst case scenarios outcomes, even if rehabilitation fails to get the patient over the hump and get them back to normal, at the very least, I'm now dealing with a joint that has healthier muscles, healthier environment in which I can, the seeds that I plant will have an opportunity to grow. It's in the situations where people are either reaching roadblocks, they're not progressing, or the rehab process is causing too much pain. Those are situations in which my involvement would be very helpful, because I can understand why this is not progressing, why it's breaking down. We can do pain mapping or a diagnostic ultrasound to visualize the structures deep to the tissue and understand what's defective in this scenario that's not allowing physical therapy to proceed. And those are scenarios oftentimes where regenerative therapies can be very helpful, but it just takes a good eye and an understanding of how the body repairs from injury to know when to use it, when to not.
It's a pretty fantastic holistic process I like hearing, and it's a pretty honest one, which is, I think, refreshing. So I think one of the things that I like about the Wellward is this HEAL motto that you have. Care to share it with these guys?
Yeah, so HEAL is the methodology that we use in every single pain scenario. We might not be explicit about it, but it's involved in every single one of our cases, and it's what I wrote about in 50 Shades of Pain book. It's an acronym for a methodology that stands for hearing the message your body is trying to convey with pain, essentially using pain as the compass to understand what's defective in the body, what is the biomechanics of it, what are the neural pathways of it, what's the cellular composition. Second is we want to envision what life is meant to be like, because a lot of patients, frankly, they've been dealing with this for such a long time in an unpredictable manner where they don't know what they're dealing with, they don't know why they're dealing with this. It starts to cannibalize their identity, and who they are becomes shaped around the pain more so than it is around who they want to be. So we want to reconnect that person with their sense of self. The third step is to alleviate pain, meaning that we're trying to to de-escalate the alarm bells that are in the body that are giving you that awareness that there's damage here. And that can happen through nerve blocks, through standard injections, through different processes that just kind of calm things down. Conventional medicine is really good at those band-aids, but it's not good at the last step, which is leveraging repair, leveraging the organic ways your body responds to injury and helping it to move along into a path that fixes problems as opposed to just putting band-aids on them.
That's a pretty outstanding philosophy. Sounds like it'll help a lot of people.
We're hoping it will. Absolutely.
Okay. I think that's good.
Well, this is kind of the end of our show. This wraps up our show for today. Thank you for watching the 50 Shades of Pain show, where we examine the spectrum of issues and shades that make up all pain conditions. We believe that each patient is unique, and there are numerous factors that can contribute to your pain. So in that spirit, we honor each patient as an individual, and we tailor treatment plans specifically designed to optimize your health. Our WellWord team looks forward to partnering with you. I'm Dr. Donish.
And I'm Dr. Escaloni.
We encourage you to start your healing journey at wellwordmed.com. Thank you.
Bye.
I guess I have to turn it off here too.
It's like, hit the button.